So I'm Brian Smolik. I'm a 39-year-old American. I live in Portland, Oregon. Yeah, I've liked Malaysia a lot so far. I mean, unfortunately, I've been in the surgery center and just my hotel, which is the Hilton, for about 5 weeks, but what I have been able to do, I've liked. Well, unfortunately, I've had really bad knees for a long time. When I was a teenager, I tore my anterior cruciate ligament in my left knee, and then in college, I tore my anterior cruciate ligament on my right knee. Over time, because it changes your biomechanics slightly, I had significant cartilage loss on my left knee starting at about age 27. So for 12 years, I've had significant degeneration in my cartilage in my left knee. I also had some cartilage problems on my right knee, which I took care of in the United States. But I came here specifically to get my left knee taken care of by Dr. Saw. Well, I had my anterior cruciate ligament repaired on both my knees in the U.S. I also had a debridement on my left knee, which is just when they go in and clean out the knee. It doesn't really do much, but it gets rid of the loose particles. And then on my right knee, I had something called ACI, where they biopsy your cartilage, they send it to a plant, they grow the chondrocytes, and they reimplant them. Unfortunately, they aren't good for extensive cartilage damage. They aren't good on the trochlea and the patella, and it brings your knee from about maybe a 50% knee to about a 75 to 80% knee. So it doesn't create the hyaline cartilage that you could potentially do with stem cells. Well, unfortunately in the US, I have almost all the cartilage gone on my trochlea and on the patella. I had moderate arthritis. I had these thing called osteophytes, which is these bone deformities that grew. And both of my condyles, I had cartilage degeneration. So in the US, it was pretty much not treatable. So at age 39, they were going to tell me I had to have an implant or a knee replacement. I didn't think those were viable options. So for the last 3 years, I've been researching cartilage regeneration through lots of different sources, meeting with different doctors, going to different centers, and almost all solutions other than this one I found to be suboptimal. There's that ACI procedure I mentioned to you before where they biopsy your knee cartilage, send it back. In Europe, they do something called MACI, which is a variation of the same thing, but basically they implant the cells in a gel. But in the end, you get the same results. Another option is they can implant cadaver cartilage, so that someone who's recently died, they take their cartilage as donor tissue and put it back in. But unfortunately, those results aren't very good either. They're okay, they improve the situation, but it doesn't really make it better. There's also something called plugs, where they can fix little tiny lesions. And in the end, they couldn't really do everything they can do here, and so I thought this was the best option. Well, I mean, I've only actually visited doctors in the U.S. I mean, I visited a doctor in Santa Monica. I visited the Hospital for Special Surgery in New York. I alluded to meeting Dr. Broyles down in Louisiana. I did calls or teleconference after sending my MRI with a doctor in Milan, Italy, a doctor in Zurich, Switzerland, and I exchanged emails with someone in South Korea and in Singapore. With the power of the internet, though, you can research what's happening in cartilage anywhere. There's a society called the International Cartilage Repair Society, and every 18 months or so they have a meeting and they publish essentially everyone's cartilage research that's been happening over the last year and a half. So you're able to kind of keep tabs on who's doing what in terms of research and where things are progressing. And again, I mean, in my opinion, I think this is the furthest along of any cartilage procedure that's out there currently. There are a couple doctors in the United States who just started trying to replicate what Dr. Saw is doing. There was a Dr. Broyles, who's in Baton Rouge, Louisiana, who's trying to do somewhat of a variation of this. Wake Forest in the United States, which is a university in North Carolina, is starting up a clinical trial. And then there's a doctor in Alaska named David McGuire who's also trying to start it. So I talked to all three of those centers who spent a significant amount of time here. Most of them spent about 3 weeks here seeing what Dr. Saw does and trying to replicate it. So rather than being patient number 1 or 2 there, I thought it was better to come here and be patient number 300. So he has the most experience of anyone in the world with stem cell technology. In Singapore, they're doing it slightly differently, where they take stem cells out of your hip and put it under a scaffold, but that hasn't had as good results as what Dr. Saw is having. That procedure is having results more similar to that ACI and MACI. And Dr. Saw, the way he's doing it by using your peripheral blood stem cells, is actually creating type 2 collagen, which is kind of the holy grail in cartilage regeneration. Is actually real cartilage as opposed to fibrocartilage, which is what all these other procedures are doing. So because of that, he can help fix problems that have previously been unfixable. He can fix massive uncontained lesions, he can fix bone-on-bone lesions, he can fix multiple lesions. And if you talk to the patients, they seem to be doing very well after 1 or 2 years, and the side effects seem to be somewhat limited. So, the reason why I decided specifically to come here was either do nothing, get some sort of implant, metal implant in my knee, which I didn't want to do, or wait for another technology to develop. There are other things that are maybe coming down the pike in the next 1 to 2 years, but this is the only one that could potentially help me now. And I felt comfortable with the research he had done, and as I alluded to, I talked to 3 centers in the US, which made me felt like it could help my particular condition. And I thought if it didn't work, the downside would be somewhat limited. I'd still be better than I was before, and it probably wouldn't do any harm to the rest of my body or anything like that. You can't really understate how innovative this technique is, and people have been trying to create hyaline cartilage for 20 or 30 years, and no one's able to do it. SAW is really the first one to be able to do that and treat effectively conditions that are as difficult to treat as this. Everything here has been world class. Everyone's been very professional and hands-on. Everyone's been very involved. There's a lot of physio involved afterwards, and I spend anywhere from 4 to 6 hours here a day kind of going through all the mechanics there. Dr. Saw comes and talks to me all the time, and when I was in the ward, I thought that was great. There's a good restaurant downstairs, so that was good too. Yeah, time will tell in 6 to 12 months when my knee is fully recovering, but so far I've been happy with how things have progressed, and I would do it again. Yeah, they do everything here to try and make you feel as comfortable as possible. Unfortunately, you feel uncomfortable because you've had drillings in your knee and it's very swollen for the first 3 or 4 weeks, but they do everything to try and subside those symptoms and get you on the recovery path. Yeah, I could recommend coming here because I think this is the best procedure to fix your cartilage. What do I think about the center so far? It's been great. So obviously it's hard to tell so far how my knee specifically is going to do, but I've been happy with the care I've gotten so far. Everyone's been very friendly. People have been very involved, and I've had a lot of hands-on attention. It's been a world-class center, and I'd do it again.